Thank you everyone for joining us for tonight's webinar on the role of nutrition for cancer patients. When diagnosed with cancer, nutrition becomes even more important. Good nutrition can help you feel better, reduce the risk of infection, keep your strength up, and help you heal faster. During this informational webinar, you will learn the building blocks of a healthy diet as well as the nutritional needs throughout treatment. I am Mary Margaret Kilmeyer, and I am the Patient Resource Coordinator for Debbie's Dream Foundation Curing Stomach Cancer. I am a licensed marriage and family therapist and currently completing my doctorate. My clinical and research background is focused on working collaboratively with doctors, patients, their families, and members of a healthcare team. We would like to thank Genentech for providing funding to make this webinar possible. We would also like to thank our promotional partner, Patient Resource. You will be able to ask questions during tonight's presentation. You can type your question into the white box that appears on your screen. At the conclusion of the presentation, we will address questions as time allows. If we don't have time to address all of your questions, we will try to address it during our next webinar, taking place on January 7th at 12 noon Eastern Standard Time. In addition, the recording of this webinar will be able to be viewed on our website in approximately 1 week. Tonight, I will introduce Debbie Zellman, the founder and president of Debbie's Dream Foundation. Then Cindy Collins will present the role of nutrition for cancer patients, and then there will be time for a question and answer session at the end. I would now like to introduce the president and founder of Debbie's Dream Foundation, Debbie Zellman.
Thank you, Mary Margaret, and welcome everyone. So I want to start off by telling you about my journey. In April of 2008, I was diagnosed with stage 4 stomach cancer. At the time, I was 40 years old, the mother of 3 young children, married to a physician and a practicing attorney with my own firm. I had no risk factors for stomach cancer, and my symptoms were very vague. I was told that my chances of being alive in 5 years was only 4%. I was lucky enough to respond to the first regimen of chemotherapy that I received. And a year after being diagnosed, I was still alive and kicking and realized that I was fortunate because I had lived. But I also realized that there were no resources for stomach cancer patients. So in April of 2009, I founded Debbie's Dream Foundation Curing Stomach Cancer. I still am an active patient. I receive Herceptin every 3 weeks by IV, and I take Tykerb, which is an oral chemotherapy, every night. As part of my advocacy with Debbie's Dream Foundation, I am a patient advocate on the National Cancer Institute Esophago-Gastric Task Force. I'm also a patient advocate on the NCCN Gastric and Esophageal Guidelines Committee. I do more advocacy as well. I'm a member with Debbie's Dream Foundation of the Deadliest Cancers Coalition, PEAK, which is the Patient Equal Access Coalition, and SPEAK, which is the State Patient Equal Access Coalition. And we are also a member of OVAC, which is One Voice Against Cancer. And a lot of people joke with me. Most notably, though, I appeared on Dr. Oz in an episode about stomach cancer. Next slide, please. So just to tell you some statistics about stomach cancer, and we may have some listeners on the call who have other types of cancers, which is great. That's fine. Please do not hang up, but we do want to inform everyone about stomach cancer. The talk tonight will be about nutrition in general. But stomach cancer is one of the leading causes of cancer death worldwide. A lot of people don't realize that. It's the second biggest cancer killer in men and 4th in women. Each year, nearly 930,000 people worldwide are diagnosed with stomach cancer, and approximately 700,000 will die. In America, it's considered a small population cancer. About 22,000 Americans will be diagnosed with stomach cancer each year, and more than 11,000 will die. However, in America, it is on the rise in young people, ages 25 to 39. They're not sure why, but that is a surprising and shocking statistic. In the U.S., per cancer death, stomach cancer receives the least amount of federal research funds of any cancer. As I've mentioned before, there are few resources and support services for stomach cancer patients, and most people don't know very much about this deadly disease. Next slide. So our mission with Debbie Stream Foundation Curing Stomach Cancer is to raise awareness about stomach cancer, to advance funding for research, and provide education and support internationally to patients, families, and caregivers with the ultimate goal of curing stomach cancer. Our website is www.debbiestream.org. Next slide, please. Just to give you a brief summary of some of our milestones, we've held events all across the United States. We have 24 chapters. 21 are in the United States, 2 are in Canada, and 1 in Germany. We hold stomach cancer education symposia free, as well as webinars for free all year round. The Patient Resource Education Program that we abbreviate PREP prepares people for the journey they're about to take, whether it's a patient, their family, a caregiver, or a friend. We help hundreds of inquirers throughout the world in many, many countries. The PREP program matches the inquirer with a mentor, and that mentor will be another stomach cancer survivor or caregiver, and it uses very specific disease criteria, including stage, biomarkers, age, gender, and region. In addition, Debbie's Dream Foundation offers a variety of support and education resources on our website, containing in-depth stomach cancer information on our Stomach Cancer 101 content through our lecture library, clinical trials information and matching service, blog topics, resources and related links, as well as the only one of its kind of a stomach cancer support community. In addition, our website is translatable into more than 60 languages by going to the bottom of the homepage and selecting a language. We've also given $150,000 in research grant funding. In addition, we have now advocated and successfully advocated, I might add, for increased federal funding through our Stomach Cancer Capitol Hill Advocacy Days. We've held 2, and our Capitol Hill briefing that we had this past February. We've been able to influence the federal government to include stomach cancer in a $50 million pot of money for cancer research. Next slide. This is just a brief snapshot on this next slide of our homepage of our website, which is pretty easy to navigate, including finding the resource inquiry form to enroll in the PREP program, along with finding clinical trials, our blog, and our support community. Next slide. We also have an array of events. These are just some of the upcoming events that we'd love for all the listeners to get involved in. Marathons, Nights of Laughter, our advocacy coming up in DC, our next symposium and gala. That symposium is available via live webcast as well. A DC Cocktails and Cupcakes, and an International Stomach Cancer Genes Day that we hold every year. And at this time, I'm going to turn the floor back over to our moderator, Mary Margaret Kilmeyer. Thank you.
Thank you, Debbie. So this is some information about the headquarters of Debbie's Dream Foundation. We're located in Davie, here in South Florida. Our office is open weekdays, Monday through Friday, from 8 to 5. And on this slide, you'll see some more of our contact information, phone numbers, and important email addresses for you. And at this time, we will start the presentation on nutrition and cancer. Our presenter is Cindy Collins from South Florida Radiation Oncology. Dr. Collins is originally from South Florida. She graduated from the University of Florida in 1982 with a degree of biology and with her master's degree in 1987 in human science and nutrition. She joined the NIH Clinical Research Center. In 2007, she completed her Ph.D. in experimental psychology with a dissertation on hope, coping style, quality of life, knowledge about cancer and risk for dietary deficiency in patients with total gastrectomy for stomach cancer. We're excited to have Cindy here with us tonight, and at this time I will turn it over to her.
Thank you very much for that introduction. Good evening, everybody. I'm so glad that you could join us. Everything I'm about to say actually applies to all cancer patients, with a few added facts that are specific to patients who have stomach cancer. And I'll take questions on both general nutrition, cancer nutrition, and stomach cancer when we finish. The first slide right away shows you beautiful pictures of protein foods. Protein is probably the most important constituent in the diet of a cancer patient. It's exceptionally variable in our diet. It's easy to get. And what you see here are all animal proteins, basically fish, lean meats, and a few other proteins that are available. Next slide, please. This gives you an idea of what protein does for us in our body. We actually hope never to use the protein for energy. We're hoping instead that the protein you eat becomes part of all the other constituents. In other words, you need to make tissue from protein, making your muscles, making your collagen, healing wounds that you have. Even your enzymes, your hormones, and your immune cells are coming from proteins. Antibodies are specifically proteins. So as you can see, protein in the body is the first and foremost constituent that you need to have in the diet. Next slide. So here are some more examples of protein, but giving you an idea of how much you're getting from each sample. So all of our animal sources, chicken as well as pork, sirloin, they're very, very high in protein per the volume that you would normally eat. 26 grams for chicken, 18 for a sirloin. Some other animal products that are high in protein include yogurt, as you see there, with 11 grams, even a cup of milk, and also we have plant proteins. So beans are pretty high. See them in the middle of the chart. 1 cup of dry beans is 16 grams. Peanut butter gives you 8 grams for 2 tablespoons of protein. And there are 2 grains that are surprisingly high in protein. One of those is quinoa, which some of you are probably familiar with. It's actually the seed of a plant, so that's what gives it such a high protein content. And the other one is orzo. Orzo has 7 grams per cup of orzo, 7 grams of protein. So that's an excellent source. So whether you're a vegetarian or not, you can get a lot of good protein into your diet. Next slide. All right, protein is important for every type of vegetarian, and sometimes those of us who have decided to go on a plant diet or a plant-based diet are unsure about getting adequate protein. So I've listed here the fact that certain vegetarians are only eating animal products. That's where your beans and your peas and nuts become your best source of protein. And soy, which is actually coming from a seed as well, is an excellent source of protein. Others of us would like to be a lacto-ovo vegetarian, so in order to enhance our protein intake, we then tend to add some dairy, which it is an animal product, but it's only one of animal product. It's not putting a lot of animal product into your diet. So a lacto-ovo vegetarian, lacto refers to the dairy and ovo refers to the eggs. So it's easy to get adequate protein if you do include a few of the animal products. Next slide. So in addition to protein, it's extremely important that we're getting a lot of antioxidants. And I know that's a term that's out there now. I'm not sure how well we're explaining it. Antioxidants are chemicals that are in the food, and they actually are the pigment of the food. So that's why I chose these pictures, because they're very bright. They show you all of the color or the pigment that your fruits and your vegetables carry. So you can see very bright mango, cherry, kiwi, strawberries. These foods are so high in antioxidants, which are exceptionally important in fighting against cancer. A lot of our research shows that the antioxidants help prevent cancer, but also that once someone has been diagnosed with cancer, it enhances your recovery from treatment and also increases your chances of staying in remission. Next slide. Antioxidants are also the vitamins and certain minerals. So there are many different chemicals that we categorize under the title antioxidants, but some of those are the familiar vitamins that you already know. This slide shows you that vitamin A is one of the important antioxidants, and it's found in a variety of vegetables, especially in sweet potatoes. The orange color actually is the vitamin A. It's called a carotenoid, but you can also find it in vegetables that are other colors, like you're seeing the dark green vegetable here. Even certain fruits, like mangoes and apricots and cantaloupe, also have the vitamin A. Next slide. Another antioxidant, which I know is familiar to everyone, is vitamin C. And the first thing we usually think about is some kind of citrus when we're thinking about getting vitamin C in the diet. It actually comes in a variety of foods, to include the berries, which I've shown here. Especially strawberries are very high in vitamin C, but even some vegetables, including broccoli and other vegetables that are in the cabbage family, and even a sweet potato can be very high in vitamin C. So the thing about vitamin C is that you'd like to get a little extra in the diet, especially as a stomach cancer patient. And I'm going to touch on this a little bit later. It has to do with the absorption of your other nutrients, especially vitamin B12 and calcium. Next slide. The most powerful antioxidant in the diet is vitamin E. So you see that you're needing 300 to 600 milligrams daily. And vitamin E is not quite as variable in the diet. It does come from oils, specifically olive oil, and the oils out of other seeds, and even the oil from wheat germ. And it comes from certain nuts, like the almonds that you're seeing there, and then even from asparagus, but it's not at quite the variety that you might think. So it's very important to include plant oils in your diet, and also some nuts for your vitamin E. Next slide. Okay, finally, here's a mineral. Selenium is not a vitamin, but it is a mineral, and we need very, very tiny amounts in the diet. You see 150 micrograms, so that's 1/1000th of the milligram. So you don't really need as much, but that can be a little deceiving. Even though it's needed in very small quantities, it's exceptionally important as an antioxidant, and you probably have read about its importance in the immune system, which is absolutely true. So some of the foods that provide selenium for you are meat and fish, but then also eggs and certain whole grains. Important that you're eating what's called a whole grain, which means that the bran and the fiber are still on the grain, like whole wheat, brown rice, and even whole wheat pasta. Next slide. Here's another great picture of dairy, and I've chosen this one because we typically associate calcium with dairy. In cancer patients, calcium is important, but in stomach cancer patients, it becomes exceptionally important because the acidity of the stomach has been altered either by the cancer itself or by the surgery that you may have, whether it's a subtotal or total gastrectomy. There's a little bit of deficiency. The acid has changed in the fact that the stomach may not produce as much. And when you don't produce as much stomach acid, you aren't able to absorb as much of the calcium that you're eating. So the best thing to do is really eat more in the diet. Some patients even require a supplement. So these are some examples of dairy sources of calcium. Next slide. And this slide is full of many other sources of calcium, which really surprises a lot of people. The dairy sources are listed in the second column, but there are also sources that are actually dark green vegetables: kale, collard greens, spinach, broccoli, and arugula. And less known options include flax seeds, even almond milk. Some of you are probably drinking almond milk if you're lactose intolerant. Even garlic has calcium in it. So you can find a lot of good sources in the diet for calcium, and it is advised that it's better to take food sources rather than have very high supplements of calcium. There's a lot of new data lately about staying away from super high supplemental sources of calcium. So I would really recommend that you try to expand your diet, include more and more calcium sources. Next slide. iron becomes very important during cancer. Some patients who undergo chemotherapy end up anemic. I'm sure that's happened to some of you. Also, for stomach cancer patients, once again, the lack of acidity with the changes to the stomach can make it that you don't absorb the iron that you are eating. So what I'm showing here is the fact that in nature, we have two major sources of iron. One is called heme iron, and that's coming out of animal products. That's why you see fish there and you see the chicken. That is the most absorbable iron that you can eat. You might, though, prefer to eat more of a plant-based diet. If you do, you're looking at what's called non-heme iron. That's in your fortified cereals, it's in soybeans, all your enriched breads and other carbohydrates, and even in peanut butter and nuts. So those two sources are important. The first is more absorbable, but the second one is really just as important. And I'm going to show you in the next slide how you can make that second source more absorbable. Take note also that I've mentioned at the bottom of sources B12. And the reason I've done that is, once again, vitamin B12 is a deficiency risk for stomach cancer patients. B12 requires the stomach to function at 100% in order for it to be absorbed in the intestine. And because it's not always functioning at 100% and producing something we call intrinsic factor, then you might eat a lot of B12 but not absorb it. Next slide, please. Right, and what I'm talking about, where you're eating nutrients but then maybe not absorbing everything you eat, is called bioavailability. So this slide starts out by telling you bioavailability of your non-heme iron is enhanced. In other words, the absorption is enhanced when you eat the plant iron with vitamin C, or with a plant product, the heme iron, or actually sugars and wine. So many people say, well, okay, I'm set now because I'll have the sugars and wine. But I've given you some other examples of what you can do at the bottom. If you eat your fortified cereal along with fruit, especially a citrus fruit, you'll absorb more iron. If you put some high vitamin C vegetables in your bean soup, like broccoli, you'll absorb more iron. And having a leafy green salad with fruit, or even your heme iron with fruit, will absorb all the iron that's in the vegetable. So it's a good idea to start making these combinations where you're including the high vitamin C foods along with your iron sources. Next slide, please. So what I'm talking about now is the fact that there are a lot of side effects to treatment. So I know tonight we probably have some people who are interested in prevention, some who are undergoing treatment at this time, and maybe some of you have completed your treatment. But I wanted to make sure that I included some of the typical side effects that a cancer patient is often dealing with in some of the nutritional solutions. I just also want to outline the fact that some of your side effects are purely biological. You actually do need more energy as a cancer patient. You're utilizing more calories, and the treatment causes your body often to utilize even more. Physically, you might even undergo surgery, which makes it impossible or difficult to eat the food that you need to eat. Emotionally, your food can become very narrow. You may have anxiety, depression, isolation. Many of these things will affect how much food you're eating. And what happens after you're not getting the nutrients you eat is that you're also not able to then fight off infections and heal as well from the cancer as well as from the treatment. So we're exceptionally interested in making sure that all of your nutrients are at their top notch and that you are in good condition physically, emotionally, and biologically, as good as you can be in order to absorb the nutrients that you're eating. Next slide, please. Here are some examples of how you can help yourself to get the nutrients that you need. And specifically, we're looking at calories here. If you will graze throughout the day and eat just small mini meals throughout the day, it might be easier to get the total calories that you need. It's also usually best to have your drinks, anything that is liquid, in between the meals. And you can pick meals that are higher in protein. You can also look to see when you feel more like eating. When is your appetite up? When is your energy up? When is it that you're more likely to eat more food? It might even be if you're socializing that you eat more as opposed to if you're staying alone. Some people eat more in front of the TV because it's mindless eating. Some people need to really concentrate to eat in order to relax, which I'm also going to cover again in just a few minutes. You can even stimulate your appetite by doing just a little bit of stretching or walking. And you could also try to change your food to make it a little more interesting and get a little bit more variety. These are all good suggestions and ways to prevent weight loss, which can become a difficult issue during cancer treatment. Next slide, please. Food odors become a very unexpected and unusual side effect for many patients. If the food is colder, you tend not to smell it as much. You may not need to be around while the food is being cooked. It might be really hard for you to smell the food as it's being cooked. I also have patients who have bought essential oils, not listed on this slide, but like a lavender oil or a citrus oil, and they put just a little dab under their nose so that they're not going to smell, you know, the odor of the food. And that's a little trick that you can do to try to block what you're smelling, because food aversions can be formed even from smelling the food. Next slide, please. Nausea is a very common side effect, and it comes in all different degrees. You will likely be given medication for nausea, excuse me, if you're under treatment. But there are some very important things you can do for yourself, because sometimes the medication doesn't completely cover the nausea issue. So trying to have things chilled, drinking through a straw, rinsing your mouth out before and after meals, snacking on saltines helps a lot, and hard candies can help to calm the nausea. Next slide, please. As you see here, some of these dry foods that really help with nausea are the ones you're probably used to for other reasons. Toast and crackers, a very dry oatmeal works. You can cook it, but then don't put a lot of cream or milk-based things into it. Even popsicles or clear liquids are very easy on the stomach when you have nausea. And ginger is a great solution. You can get ginger candies and let them dissolve on your tongue. You can get dried ginger, which kind of looks like a dried fruit. You can get ginger capsules, and even ginger tea is available. It turns out that ginger ale is not really very high in actual ginger unless you go, for example, to the health food store, and you'll find some ginger drinks that are much stronger than the usual ginger ale. What to stay away from is just as important as what to eat for nausea. Stay away from any greasy or fried foods. They'll just make your stomach empty slower and make you feel worse. And also the high sugary foods make it really difficult to combat nausea. Next slide, please. Water. I love this slide because I think we forget about water and how important hydration is. And it's very important that you stay hydrated. It can affect fatigue tremendously. It can also affect whether you're experiencing headaches or not. And then basically water is just important for all the functions of the body. Next slide, please. Some people would rather drink tea, which is great, and I'm trying to show you here that decaffeinated and herbal teas are very useful. They count as fluids as well, and they're also very relaxing. There are a number of teas that are somewhat medicinal as well. We just spoke of ginger tea, and chamomile tea is very relaxing. Peppermint tea is very good for lower abdominal cramping. So tea high in antioxidants like green tea or white tea is something that you'd like to include and also counts as a fluid for you as long as it's not caffeinated. Next slide, please. Diarrhea is a somewhat common symptom for certain therapies, as well as for cancer patients that have stomach cancer, typically if they've had a gastrectomy and have what we call dumping. Diarrhea is something that first needs to be thought about as something that's not keeping you hydrated. That's the most important thing, is that you're losing a lot of fluid when you have diarrhea. So in addition to the fact that you need to maybe change your diet so that you don't lose as much of the food, you need to replace the water. So again, I'm listing here lots of fluids, decaffeinated coffees and teas, broths, and very diluted juices. You don't want a concentrated juice because the sugar would probably just make the diarrhea worse. Next slide, please. The opposite problem sometimes happens, and that's constipation, and water is just as important during constipation. It actually sometimes can resolve the constipation, as well as making sure you have plenty of fiber, and also do some exercise. Movement of the abdomen helps to alleviate constipation. And oils in the diet are also very important. Next slide. I included this slide because specifically for cancer patients and especially for stomach cancer patients, relaxing while you're eating and being mindful of what you're eating becomes very, very important. I've worked with stomach cancer since 1987, and something that's become very obvious to me and a mission of mine is to help people learn to be relaxed while they're eating. If you're able to breathe easy and eat in a relaxed fashion, you're actually turning on the other side of the nervous system, what's called the parasympathetic, where your blood flow is the correct one for better digestion. So you'll probably ease a lot of your symptoms in the stomach, in the esophagus, like reflux, and even symptoms you might have in your lower intestine when you're more relaxed and eating well and have easy breathing. So mindful eating is one way to do that. Mindfulness is something you've probably heard about. It's out there in the literature, and it's a good idea to study up on mindfulness, and especially when it comes to your meal. Next slide, please. Anti-inflammatories are just as important as antioxidants. As you see here, oils and nut butters are very good sources of anti-inflammatories. Next slide, please. And my favorite slide, which has to do with spices. Spices can be very powerful in the body, and we've learned a lot about these spices actually from ancient cultures. I want to point out especially turmeric. There's a lot of new data on turmeric as an anti-cancer spice, and the data is very, very strong. I would recommend that everyone gets a healthy amount of turmeric in their diet. Next slide, please. This slide actually are some of the resources that I wanted to list for you because there's so much information on the internet. Some of it is definitely incorrect. Some of it's just very overwhelming. So I thought if I outlined some of the sources I used for the talk and some of the sources you would find very useful, that would help you to narrow what you're looking at and get good, reliable information. I especially want to point out the Dr. Weil's site, which is a good place to go to for a first quick look at an herb or a way of eating, and Memorial Sloan Kettering site, the one at the bottom, MSKCC. They have an entire section on herbs and supplements that's very useful and very informative. Next slide, please. Okay, that ends my talk. I hope that I was able to stimulate some questions and answer questions that you came with as well, and I look forward to taking some of your questions now. Thank you.
Thank you so much, Cindy. I'm now going to go ahead and look at the panel of questions that we've received here. The first one is, when I'm nauseous, water doesn't appeal to me, so do shakes, popsicles, and the like count as things that I can drink?
I'm sorry, can you repeat exactly what the question is asking?
Yes. When I'm nauseous, water doesn't appeal to me.
Oh.
So do shakes, popsicles, and the like count as liquids if those are the only things I can drink?
Yes, I'm sorry, I didn't hear the first part of that. Definitely. So anytime the food that you're eating becomes liquid, like a popsicle does, or it is a liquid like a soup, that counts as hydration as long as there's no caffeine. If it's a caffeinated product, that causes you to urinate more, so we can't really count that as a fluid. But any other non-caffeinated fluid food counts as hydration. A lot of times, water is a big turnoff when you're nauseous. Just plain water doesn't work. I have some patients who put just a little bit of juice in their water, and that seems to make it a little bit better. But all the other fluid foods do count.
Thank you. Another question here. Do you recommend turmeric in a pill form or in food? And if so, how much?
Well, you know, I used to recommend it, of course, mostly in food. And there are so many great foods that you can make with turmeric. Curry has turmeric, but you don't have to eat curry in order to get it. As probably everyone knows, it's an orange spice, and it doesn't have to come as a curry for you to eat. The latest data is indicating that 1,250 milligrams is the best new dose, at least in the research we have so far. That's probably going to be a couple of tablespoons a day. So in that case, unless you're making a shake or a greens drink or something where you can hide that much turmeric, I'm now suggesting that you might want to also get a supplement. And the supplements do come in capsule form as well as in liquid form. But because it's such a bigger dose of turmeric than we realized at first, you might end up needing a capsule.
Okay, great. Can you explain omega-3s versus omega-6s and their anti-inflammatory properties?
Yes, definitely. So the omega-6 is found more often in processed foods. That is a pro-inflammatory. Omega-3 is found naturally in oils as well as in fish, especially the fatty fish, which you do want, and that's an anti-inflammatory. The inflammatory process is a natural process. We have to have it. It's how our immune system takes care of our body. But when it gets turned on too high or too long, it actually becomes something that can promote certain diseases, as you know, with cancer, even heart disease. So the omega-3 fatty acid is counteracting the inflammatory process as it is occurring. That's why most of the recommendations you see are telling you that you should have a certain amount of omega-3 in your diet or in capsule form on a daily basis. You really want that in your bloodstream on a daily basis, circulating throughout your body so it can get to all the tissues and do its anti-inflammatory function.
Okay. The next question, are you familiar with the supplement Soylent, and if so, what is your opinion of it?
I'm sorry, I'm not. That's a new one. Boy, I love when I learn something new. I'm writing that down right now. That's a new one, but I can definitely look into that and try to answer that at the next webinar, or if there's any way you can communicate with us, I'll find out about Soylent.
Okay, great. We have another question here about antioxidants. Can antioxidants interfere with my chemo?
The new research says no. There was a lot of confusion and a lot of controversy on this, and even Keith Block, if you're familiar with him, I had spoken to him recently at a cancer conference, and you know, at this point, it looks like the antioxidants will not interfere with chemotherapy. They might even enhance certain chemotherapies, which is good news. However, just in case you were wondering about this as well, there is still pretty good data that they can interfere with radiation therapy. So most radiation therapists are asking patients to moderate or slow down their antioxidant intake. But for right now, you're okay with the chemotherapy.
Okay. And actually a follow-up question to that is, are there any foods that could interfere with my chemo?
There are a few chemotherapies where there are certain vitamins that interfere, but not in food form. For example, some of the GI chemotherapies are interfered with folic acid. Folic acid, or folate, is a B vitamin. It's when it's taken in supplement form that it becomes a problem. So when it's in food form, that really is not concentrated enough to be an issue. So the short answer is no. Nothing in food is actually going to interfere with your chemotherapy. But if you're inclined to take supplements, make sure you check your supplements out with your physician.
Okay. And to go back to the supplements, are there any specific supplements that you recommend, or is there a brand or company that you would recommend for supplements?
I don't like to recommend certain companies, and I do think that it's important to check them out, and there are some websites that will help you with that. I think first and foremost, when you're looking at a supplement company, if they're giving information as well as selling the product, that's probably a mixed agenda. I don't think that's a good idea. But a supplement company that has research behind it, that actually publishes research articles, I think is a good idea. And I typically do recommend turmeric. That's the one that I would across the board recommend to cancer patients. After that, if the diet is very narrow and limited, I would recommend the omega-3 fatty acids.
Okay, thank you. We have another question here that is related to gastrectomy, and before we field the question, I would like to say that this is a webinar series. We are having one webinar per month for the next 12 months, this being the first in the series, and one of those we would like to dedicate specifically to nutrition and surgical interventions such as the gastrectomy, but we'll go ahead and field this question now, if that's okay. With a total gastrectomy, are nuts and breads with high fiber okay to eat?
With the total gastrectomy, the nuts and breads can be eaten if they're in a mixed dish. The first difficulty with nuts and breads and high fiber is the anastomosis. That's where you were sewn back together, after the stomach was removed. So it's very important that foods are very liquefied or at least soft enough to get past that narrowed area. That's going to be very individual for the patient. Some patients have a very narrow healing and some have quite a wide one. So that you'll know soon enough as you trial larger and larger amounts of fiber. After that, we have a problem with what's called dumping syndrome. And that's where your food is going directly from your esophagus into your small intestine. So you need to be careful on the fiber amount because it could actually cause you to hold more water, get a lot of bloating, and possibly even get more diarrhea that way. So every patient who's had a total gastrectomy needs to start with very low fiber and work their way up incrementally with very small amounts. Maybe every 3 to 4 days, add just a little bit more fiber into the diet and test their own tolerance.
Okay. In thinking about tolerance in foods, can you substitute fruits or vegetable juices if you're not accustomed to or not able to tolerate the specific item?
Usually, the only time that you wouldn't use a juice, whether it's a vegetable or a fruit, is if you're concerned about the sugar concentration. So even fruit sugar is a simple sugar, and sometimes those simple sugars can enhance diarrhea, or also you don't want to raise your blood sugar. If this question is referring as well to a gastrectomy patient, they risk having an elevated blood sugar, which then takes a very quick drop, leaving them with hypoglycemia. So you would want to be very careful not to prime the pump with some concentrated juices.
Okay. And the last question that we will take this evening is, should I take mushroom extracts?
I'm a fan of mushroom extracts because I think the data is good. It's not strong enough yet that I recommend it across the board, but some of the mushrooms like maitake, shiitake, reishi, and chaga, those 4 have shown some pretty good data for boosting the immune system. So the should I take it really becomes a personal question because the data is not strong enough for us to recommend it to everyone. It'd be one of those supplements that you would decide you want to tweak and enhance your intake even a little bit more. And again, I would recommend going to Memorial Sloan Kettering's website and researching each one of those mushrooms and making a good, an informed decision on whether you take it or not. So right now, I think the data is good. I don't think it's strong enough for everyone to take it, but for those of you who really want to enhance your intake, I would definitely consider it.
Okay. Well, thank you so much, Cindy. And thank you to all of our listeners tonight. A special thank you to Debbie's Dream Foundation, Curing Stomach Cancers, Debbie Zellman, President and Founder, and our speaker, Cindy Collins from South Florida Radiation Oncology. We'd also like to thank Genentech for providing funding that helped make this webinar possible.
Thank you.
As you see on your screen, we have upcoming events to get involved in and support. Details about these events can be found and are available on the Debbie's Dream website at www.debbiesdream.org. Our next nutrition webinar will be held on January 7th at 12 noon Eastern Standard Time, and the slides and presentation from this evening will be available on our website under the lecture library. We would love to hear your feedback before our next upcoming webinar. Please send your questions and comments to patient.resource@debbiesdream.org. For all who joined us this evening, you are welcome to stay on for the clinical trials webinar, which will begin shortly.